Okay, we should be all set, Kevin.
Okay, thanks, Brett. Okay, all right, Jordan, are you there? Are you on today?
I'm here.
Okay, all right. And Dr. Morris, are you on?
Yes, I am.
Okay, good, thank you. Okay, well, we're gonna go ahead and get started then. Again, thanks guys for taking time to hop on the call with us today. We will start off with updates on the numbers, and I'll go ahead and have Jordan do that. And then on the last meeting, I know there were a couple of questions that came up on the COVID vaccine, and so I did ask Dr. Morris, our medical director, if she could attend today, and ask that she do a kind of an update on vaccine, and then maybe be able to answer some questions that you have. So that'll kind of be the format that we'll go with today. So as far as the numbers go, Jordan, I'll turn it over to you.
All right, thanks, Kevin. So with the holiday, we have numbers from Wednesday at 3:01 p.m. until yesterday at 3 p.m. There were 736 new cases. Over the past week, from Tuesday 11/24 to Monday 11/30, there were 949 new cases, and the week before that there were 988 cases. So we have seen a 3.9% decrease in cases in the past week. Our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 6,683. Over that time period, cases have been identified from school exposure, household exposure, care facility workers and residents, healthcare workers, those in attendance of social gatherings and religious services, those who recently traveled, a casino exposure, community contacts, and other worksite exposures. Cases by county as of yesterday are Crawford with 331, Kalkaska 348, Lake 200, Manistee 363, Mason 565, Mecosta 1,211, with Ferris State University dashboard reporting 481 cases, Misaki 271 cases, Newaygo 1,593, Oceana 1,165, Wexford 636. In the past week, we had 13 deaths and 496 people who recovered. Currently, there are 16 positive inpatient cases at Munson Healthcare Cadillac, 8 positive inpatient at Munson Grayling, 4 positive inpatient at Munson Manistee, 9 at Spectrum Health Big Rapids, 7 at Spectrum Health Gerber Memorial, and 13 at Spectrum Health Ludington. That's what I have today.
Okay, thanks, Jordan. Any questions on the data? Okay, then just a couple other updates before we kind of move into the vaccine. You know, in addition to the case investigation and contact tracing efforts that the health department is involved in, we do continue to work with our local schools and businesses and work sites in addressing questions and concerns that they have. We also are involved with flu clinics, setting up flu clinics in our jurisdiction. And we do have a number of flu clinics that are taking place, some today, some later this month. We do have one that'll be taking place tonight. This is going to be a drive-through flu clinic. It'll be in Cadillac from 5 to 8 at the Cherry Grove Fire Department. And then we have another one that'll be taking place in Manistee today. That's going on from 9 to 3. It's at the Road Commission, the Manistee County Road Commission, a drive-through clinic. We have one on Thursday, December 4th. That's from 9 a.m. to 3 p.m. And that's at the Herring Township Fire Department. And then one on December 9th, that'll be in Mesick at the bus garage. So those are some of the flu clinics that we have set up in the jurisdiction so far. There will be some others on our website. We do have some other clinics that'll be listed, and I'm sure we'll be setting up some additional ones. We are going to be this Sunday doing setting up a COVID testing opportunity in Mason County. We've partnered with a company called Hanu They run the state's neighborhood testing sites. And so they will be offering drive-through testing at the Ludington, the City of Ludington DPW garage. And then we also will be providing flu immunizations at that testing opportunity. And so if there are other communities that are interested in exploring having a COVID testing opportunity, please reach out to us and we will see about whether or not we can get something like that set up in your community. In addition to that, probably within the past week or so, we've become involved in a few more enforcement efforts in our communities, predominantly with restaurants and bars, working alongside MSP and the Michigan Liquor Control Commission to try to initiate some enforcement type issues. We have issued a number of cease and desist orders on some restaurants that continue to allow indoor dining. I know the Liquor Control Commission has suspended a couple of liquor licenses in our jurisdiction in establishments that were operating in defiance of the epidemic order. And I know we have escalated a couple of other complaints up to the Michigan Department of Agriculture and Rural Development, which is the state entity that oversees they're responsible for the licenses, the food licenses. Yes, we provide that, but it's a state license that we provide. And so I know they will be following up with some establishments to issue a cease and desist order, which is their first step in potentially pulling a food license from an establishment. So hoping it won't get to that point, but if it does, then there are some steps that need to be taken, and we have initiated those processes. And it's one of the unfortunate, not fun activities that the health department is involved in dealing with this virus at the local level, but it is one of the roles that we find gets assigned to health departments to help address. So those are some of the update pieces that are going on. The current epidemic order that is in place is set to expire on the 8th. I'm assuming that we will know whether or not it's going to be extended, continued, lessened, strengthened, whatever. Probably, I would assume, we'll be hearing something sometime this week, although I can't say for certain. And so, we'll move forward with whatever happens. So those are some of the other updates that I have. If there aren't any other questions, well, we can do questions all together at the end. I'll go ahead and then turn it over to Dr. Morris, and if Dr. Morris is ready, she can kind of provide an update on the COVID vaccine, which is the next piece that we will be moving into. So Dr. Morris.
Thank you. So I will just run through the 3 vaccines and just kind of the plans as we know it going forward. Hopefully that is the hope of the group. The 3 vaccines that we're looking at right now is one by Pfizer, one by Moderna, and then one that I won't spend as much time on, but the one by Astrazeneca. The first 2 vaccines by Pfizer and Moderna are unique vaccines. They utilize a messenger RNA technology, which is new in that we've not had a vaccine that uses this technology before. However, several different kinds of vaccines have been studied using this. They've looked at flu vaccines, Zika vaccines, other viral vaccines using this technology. None of them have ever gone to market because they utilize a much longer study period in the real world when we're not in an emergency. So in a nutshell, how that works, our DNA is kind of our motherboard, our main boss of our cells, but then that makes messenger RNA, and there's messenger RNA, other kinds of RNA in our cells that kind of get the work done. So messenger RNA tells our cells how to make different kinds of proteins. They basically programmed messenger RNA to program the cell to build the spike protein of the virus. That's the part of the virus that allows it to attach to our cells to infect our cells. So when you see the pictures of the coronavirus and you see the spikes coming off of that cell, that's what it is programming our cells to make. The messenger RNA that would get injected into us would get taken up by our cells. Our cells would make this protein. That messenger RNA gets degraded in less than a day. So there's really no concerns that it'll hang around and do anything. It should in no way be able to enter our DNA, anything like that. But then the spike protein is present. Our immune system recognizes that, hey, that shouldn't be there, and creates an immune response to it, just like any other vaccine would. And if our body sees the whole virus, someday is able to then mount an immune response to it without having had to have been infected before. So that's the technology that the Moderna and the Pfizer vaccine use. The Pfizer vaccine, which has their application into the FDA to get the emergency use authorization. Obviously, we heard about that first. The FDA will meet on the 10th to discuss giving that emergency use authorization. The CDC is actually, or the Advisory Committee for Immunization Practices is having a meeting right now to discuss allocation of vaccine. So things are moving quite quickly. So with Pfizer, they found it to be 95% effective. What that meant is in 43,000 people, there were 170 cases of COVID. Only 8 of those cases were in people that got the vaccine. The other 162 cases were in people that had the placebo. It appeared to be equally effective in people that were over 65, which is, one of our main concerns. It is a series of 2 doses, 21 days apart. The Moderna vaccine hopes to be getting their application to the FDA for their emergency use authorization into the FDA by the 22nd this month. So
78 degrees 0 Celsius.
Can you, whoever's using the phone, can you make sure you're on mute or your computers? Thanks. So Moderna has similar efficacy. They have 94.5% efficacy, which boils down to of 30,000 individuals studied, there were 95 cases, 5 in the vaccine group, 90 in the placebo group. It is a series of 2 doses that are 28 days apart. With vaccines, you can typically go longer apart if you have to. You just can't be closer together. A couple of issues will be, if you get the Pfizer vaccine first, you have to get the Pfizer vaccine second. So we have to make sure people get the same vaccine. And then just the timing, making sure our timing is correct. Side effects, there were no serious complications noted. A good percentage of people, between 3 to 10%, did have tiredness, muscle aches, headache, some fever, and it was significant in a small percentage of people. Significant meaning they might have had to stay home from work for a day, things like that. So there's already discussions ongoing of how to give this, say, to healthcare workers, giving it to them at the end of their 3 days of 12-hour shifts, so that if they were to feel really tired or have a fever, it would be during the time that they would be off for a few days. Because again, when there are reactions like that, we know it's causing a good immune response. So to us, it's like, yay, good, it's going to work really well, but we don't want to affect people's work life or anything like that. But again, at this point, it does not seem like there's any serious reactions. It will be very, very closely followed. There's numerous different mechanisms to follow the safety. They've actually developed an app that particularly healthcare workers that are being vaccinated will participate in. It's called V-Safe. That app is not available yet, but it will go live, and will actively track people after vaccination to ensure there are no adverse events. And there are numerous other safety tracking programs out there that follow like acute care settings. Even Veterans Affairs has a way of monitoring for safety. So there's many different ways this will be tracked, and they'll continue tracking efficacy long-term. So we expect, once this is approved, and again, the ACIP is meeting now to determine allocations. We expect Michigan and other states to get small allotments week by week, probably less than 100,000 doses a week. The first group that will get vaccinated will be healthcare workers and residents of long-term care facilities. And even within those groups, there will have to be prioritization. It will mainly be left up to those individual organizations. So for instance, in your healthcare group, if your healthcare facility is getting 400 doses, you would want to consider who's at highest risk for getting COVID in this group. And so it may be your emergency room workers, your ICU workers, things like that, because it will be rather than burst of vaccine. The Pfizer vaccine does need to be stored at extremely low temperatures, -70, and deep freezers are becoming available. And so all that's being worked out. The third vaccine I mentioned is the Astrazeneca vaccine. That uses a newer technology as well. They took an adenovirus, which is like a cold virus, but one that's specific for chimpanzees, because then we don't have any pre-existing immunity to it, so we can't inadvertently inactivate it. But then they took it and made it so that that can't make us sick in any way. And then they put that spike protein from COVID onto that virus. So it's very interesting science going on. They studied it as a 1 dose. They studied it as 2 doses, 28 days apart. They studied it with a half dose first and then a whole dose. Overall, looking at all their different models, it's around 70% effective. Some of their trials had it at 90% effective, but they're looking over their numbers to make sure they have all of that data correct, and there's not as much data available yet from them. So I think that is about what I have right now. Again, there's just a lot of information coming, but just to know right now, the first groups that will get it will be healthcare facilities through their organization, long-term care facilities, nursing homes mostly will be vaccinated by pharmacists from Walgreens and CVS, other long-term care facilities like AFCs and homes for the aged may be vaccinated by the National Guard. That's being worked on. The next set of individuals will likely be people with comorbidities that put them at higher risk, and then people that are over 65. But all that is being discussed and voted on further with the ACIP. So I will pass it back to Kevin.
Okay, thanks, Dr. Morris. Okay, so those were the updates that we have. And so I guess, why don't we go ahead and open it up for questions? Brett, do you mind reading the chat questions?
Sure, we've got a couple of them. So the first one is, the question is for known positive COVID people. What is the protocol going forth in regard to required safety protocols meant for those people? So for example, police officer gets exposed to COVID, is a positive case, and returns to work. He now gets the sniffles, but the safety plan requires him to go through COVID exposure testing and safety protocols, i.e. a 14-day isolation. Is there any exceptions regarding known recovered positive COVID persons from the extensive safety protocols, and if so, for how long?
Do you want me to take that, Kevin?
Yeah, why don't you? I think,
Yep.
because I think that pertains to that 3-month period.
Yep. Yeah. So just to make sure I understand that question, and correct me, whoever asked that, if I'm wrong. So if you have an individual who is a confirmed positive case, so someone who tested positive and recovers, and then they're re-exposed in the future, if it is within 3 months of when their previous case started, whether it was onset of symptoms or a positive test result, if they were asymptomatic, if they're re-exposed within that 3-month time frame, sometimes we have to actually count out the 90 days, they do not need to quarantine again. If they're exposed after 3 months or 90 days, then they do need to quarantine again if they're re-exposed.
Dr. Morris, I think part of that question is if they're showing symptoms again. So does that apply as well?
If they're showing symptoms, they need to follow up with their healthcare provider or kind of use best judgment. So it's not recommended that they get tested unless, basically if there's no other reason for them to be sick besides COVID and they seem to be high risk for COVID. Reinfection within 3 months has not really been seen. So if you have an individual who has symptoms of COVID and they've already been infected and it's 2 months later and they just spent 3 days in a house with their mother who was dying of COVID and they have no other possible illness, then you may want to send them home and maybe have them talk to their healthcare provider. But in those 3 months, it's very unlikely. The issue that you may be getting at is the new Public Act, which requires you to send them home if they have symptoms. Again, according to the CDC and according to what we know, we just don't see people getting reinfected within those 3 months for the most part, unless they have some really unusual situations. So if you have questions about those kinds of situations, you can always call us for further guidance.
And the Public Act that Dr. Morris was referring to was Public Act 238 that was implemented, I believe, took effect the end of October, but actually was made retroactive back to March, and it does identify it identifies what are now considered the principal symptoms of COVID, and then lists what needs to happen, if someone tests positive or if someone is exposed, which, sometimes goes against some of the guidance that we have been providing. It also lists groups of individuals that technically are excused or don't have to follow quarantine guidance if they would be considered a close contact. This is not a public act that is supported by local public health. We have some concerns about it. We have recommended there be some changes, but nonetheless, it is still a public act that is out there, and it is in place. So if you need to find information on that, you can Google Public Act 238 of 2020.
Okay, and Michelle, I'm going to skip yours because Deborah's next question has to do with 238, and I'll come back to yours, Michelle. So Deborah's question is, I received a copy of the piece of the Public Act 238, and I'm still unclear. Can you confirm that staff working in an AFC, adult are exposed to a confirmed case outside of the AFC setting are allowed to return to work? If they become symptomatic with even one mild symptom, do they still continue to work? Is this putting the clients at risk?
Dr. Morris, do you want to respond, or I can? Okay.
I can, yeah. So my OSHA put out an FAQ to help address that. so that individual would be exempt from quarantine as a last resort. And we can provide the link to that FAQ. And that's where the wording in that act is a little bit difficult. Just because they're in one of those groups doesn't necessarily mean they should work. It's just if you have critical staffing shortages and you have no other options, then they are allowed to work because of the dangers of them not working. But we can find that link and provide it to that FAQ. I'm just trying to search my email right now to find it. But Kevin, I don't know if you want to add anything to that.
No, I was looking through my stuff to see if I have that FAQ also.
But I'll find it, and then also with that little bit of explanation that was provided with the link to us. But yeah, ideally, everybody should ideally quarantine, no matter what. It's just if you have critical shortages, you can't rearrange shifts, you can't get coverage, then those critical infrastructure individuals that are listed are allowed to work if you're following meticulous safety procedures, just because, again, for them to be absent is more of a danger than to have them there when they should be in quarantine. So hopefully that makes sense.
But I think the last part of that was, does it pose a risk to the residents or individuals that they may be around? And I think the answer, and Dr. Morris, correct me if I'm wrong, yes, there could be a potential risk.
Yes, correct. And so that's, again, is it more of a risk to have no staff or to have staff that could be contagious? And so, and then, if you can have them working in a different area. So again, you do the most good versus harm.
Okay, next question is, for vaccinations, will behavioral health workers be included in the healthcare group?
I think Dr. Morris had mentioned the ACIP group that is meeting today, and that is, I'm hoping that we're going to get a little bit more clarification on who will be included in there. Right now, I'm not aware that they've defined healthcare providers in terms of who makes that up. Dr. Morris may, maybe you've heard more about that, but I think we're still waiting on guidance on that.
The ACIP did have a slide during their meeting last week, but it, again, it's going to have to internally be prioritized. So I can try and find those slides from the last ACIP meeting.
Okay, because I know I don't think I've got that.
Okay, next question says, is there any reference to back up that 3-month reinfection doesn't occur? And a link. Can a link be provided?
Yes, there's evidence, or there is a link that backs up that you don't need to quarantine again. And then discussion from the CDC about reinfection. And so I'm going to start myself a list here. I'll get the MIOSHA link and the CDC link. And I'm assuming Brett or someone has the email chain we can forward these things to afterwards.
Yep, you can get it to me. I can forward it to the group.
Okay, will do. And then also the list of healthcare providers from ACIP.
Okay, next question. Should the exposed staff working in an AFC wear an N95?
So
go ahead.
unless the recommendations for all healthcare workers are, unless you're doing an aerosol generating procedure, which I can further explain if needed, but a surgical or procedural mask is sufficient. And if your client or patient is not themselves wearing a mask, you should also wear eye protection, which typically is a face shield. If you're doing an aerosol generating procedure, which would be like suctioning, trach care, a nebulizer treatment, then you should use an N95 mask. Know that though, to do that, you need to be fit tested and have a respiratory policy plan. To just use an N95 and not have been fitted is not necessarily more protection.
Okay, next question. Any thoughts on shortening quarantine length of time from 14 days to 7 to 10?
So there's been rumors and mutterings about that, but there is nothing official. So at this point, there's no change.
Okay, I believe that was the last question in the chat box. So why don't we go to the phone? So if you are only on your phone and have a question, go ahead and unmute and ask.
Dr. Morris, we all know people that are in the hospital with it or have passed away with it. Are there any new treatments you're using in the hospital, medications, remdesivir or whatever, that are being effective?
And I always preempt this by saying, you know, I'm not clinically active in the treatment of COVID, but inpatient treatment, from what I know, has not really changed much. They've learned a lot about just how to best deliver the treatment that they have. So, you know, knowing to not intubate people right away, rather use BiPAP or other types of oxygen therapy, because they don't do as well once they're intubated. An interesting technique is having people lie prone, so actually having them on their bellies helps them to breathe easier. So they're just learning a lot of different things like that. There is some new monoclonal antibody treatments they can give to outpatients that can potentially reduce the risks of needing to be admitted. So that's very promising. But as far as I know, there has not been anything new on the inpatient side. Again, just better understanding of how to treat them and when to use the treatments properly.
Okay, any other phone questions?
Yeah, hi, this is Bob from Oceana County. Question that's maybe looking out a little farther than the next couple of months or so, but any issues, information, concerns, whatever regarding vaccines that are being produced and the mutation of the virus?
So from what I have understood is that the coronaviruses do change, and this one has changed, but it's more subtle of a change than, say, influenza, where it is major shifts and drifts. So that is something, though, that they will follow, and they are going to continue to follow the efficacy of the vaccine, because if they see, you know, a change in the efficacy, it'll lead them to see why. Is the virus changing? Is something about the vaccine changing? So, so at this time, they don't really think the virus will change so much that it'll negate the vaccine, but it is something they're definitely going to follow.
And then if I could ask a follow-up that I don't know if there's an answer to, but coming into flu season, or maybe we're already there, the similarities in symptoms between flu and COVID, it's going to be difficult for employers to know whether or not someone should be, you know, potentially quarantined for 14 days or maybe the employee can come back to work after a few days because it's just seasonal flu. Any guidance or suggestions on that potential problem?
Yeah, that is going to be a problem. Another issue I'll just bring up, because it has not been studied with any other vaccines, you cannot get the COVID vaccine with any other vaccines. And we don't know yet what the spacing recommendations will be between vaccines. So, for instance, if you have an employee who got a flu shot today, we don't know if they can get the COVID vaccine tomorrow or if they have to wait a certain period of time. My suspicion is there won't be a major gap, but they certainly can't go to employee health and say, oh gosh, I need my flu shot still. Can I get that with my COVID vaccine? They will not be allowed to do that. So if you have employees who still need their flu vaccine, really push them to do that now so that's taken care of before the COVID vaccine gets here. Really advocate for the flu vaccine just so you don't have the issue you're describing. To me, the biggest difference between the flu and COVID is the onset. Flu, if anyone on the phone's ever had it, it usually starts very suddenly. For some people, it's 2:05 p.m. it started. It's very, very abrupt. Whereas COVID is usually one day I had a little headache, and then I had a little sore throat, and then I had a little stuffy nose, and then I couldn't taste things very well. More how a cold would start. So very just vague and gradual. So that's the main difference. With flu, pretty much everyone feels like they just want to die. The difference is if you've been vaccinated for flu and you get the flu, it's going to be much more mild. This is just going to be where testing is more important, and testing people for flu and COVID, both, not just one or the other. And I know our testing capacity is getting hit really hard. So I don't have a perfect answer. It's going to be tricky, but those are just some thoughts.
And I think in one other thing to kind of point out, and I know we've kind of done this with our schools before, but in that Public Act 238, where it lays out information on the principal symptoms of COVID, it does break those symptoms into two different groups. So your primary symptoms, cough, fever, shortness of breath, and then one of those versus two of the other minor symptoms that are listed there too. So whether or not that may be a help, I'm not sure, but that is now spelled out in that Public Act.
Okay. All right. Thank you.
This is Jeff from Manistee, and my question, I guess, probably goes to Kevin, and that is in regard to this current order. When the District 10 Health Department or any local health department gets called in to enforce this stuff, I guess help me understand and explain to me the chain when the governor makes an edict like she has, and then we get drug into the process of the enforcement of it. I guess just help me understand that process the best you can. And assuming we have some local authority in this process, but just don't know.
Yeah.
Hopefully that's clarification.
Okay. I'll try to make it as unmuddy as possible, Jeff, which sometimes that doesn't help or doesn't work. Within the public health code or under the public health code, local public health is charged with the authority of addressing situations that could result in the creation of public health issues or issues that could create epidemics, or in this case, obviously a pandemic. So outbreaks and things like that. So we have certain steps that we can follow. In Michigan, I believe there are 9 health departments that actually have the ability to issue fines and citations associated with this. So in the, under these orders, it lists out that I think there's a $200 fine or a $500 fine for violations of that. those health departments that have the ability to issue those citations or fines, if they, you know, are investigating it and find that this restaurant may be opening, they can actually issue a citation or a fine to them. They could do the same thing for you know, individuals who are not wearing masks when it's required that individuals wear masks. I've not heard that that's happened, but theoretically that could happen. District 10 is one of the other health, you know, so there's 45 health departments in the state. I believe, like I said, I believe there's 9 that have that authority. The remaining ones, including us, do not have that ability. So our enforcement options are somewhat limited. Ideally, we try to educate those individuals on what it is they need to follow. If necessary, we will issue a cease and desist order to try to gain compliance with what the order says. But if an entity continues to, and we'll use an example of a restaurant, if a restaurant continues to allow indoor dining once we have, you know, issued our cease and desist order and we've educated them, at that point, there's really not much other action that the local public health department can take directly. What we can do is we can reach out to the local prosecutor and see if the local prosecutor will take action upon our cease and desist order that we've issued. Some may, you know, some may not. We can also reach out to law enforcement to see if law enforcement will visit such an establishment and then issue a report on what they find. If they will issue that report, MDHHS has set up a process where law enforcement can submit that report into an enforcement and complaint section, and then MDHHS, the state health department, is able, through their process and administrative law judges, they can issue a fine to those individuals, to a restaurant or to an establishment. There also is the process that has been set up by the Michigan Department of Agriculture and Rural Development, MDARD, which is the state entity agency that really, it's their food license that we are enforcing and that we are providing to restaurants in our jurisdiction. Local public health has a contract with MDARD to do food inspections at those establishments and to kind of oversee that licensing process. But to really take a license from an establishment, that is really an MDARD decision. And so there now is in place, and we just learned of this last week, a process similar to what MDHHS has in effect, where, you know, if we have an establishment that is being non-compliant, we can submit a report up through MDARD, and MDARD would then issue a cease and desist order to such an establishment, and then that would be the first step in the process of potentially taking a license from somebody. You know, it hasn't got to that point yet, no. So, you know, how that would all work, nobody knows. So that is, you know, that's kind of, well, not kind of, that is the enforcement options that are available. But at the local level, you know, aside from, you know, educating an establishment and potentially issuing a cease and desist order, and then, you know, hoping that the entity, organization, restaurant, whatever it is, will follow that order, that's about the extent of what we can do. If they won't, then it's either, you know, we go to local law enforcement, local courts, or, you know, the state for help with that. Does that answer your question, Jeff?
Yeah, so I guess to summarize it, I know the 2 establishments in Newaygo, technically, because that falls under District 10, technically, I'm guessing from what you said, that would be relied on the state police to issue a citation, and those state agencies, whether they pull a liquor license and or if the AG wanted to prosecute, if the local prosecutor was not inclined to. Would that be correct or incorrect?
That, for the most part, that would be correct. Those establishments, actually, the establishments that you mentioned in Newaygo County, it was the Liquor Control Commission who actually kind of was first on the scene in that. They, investigated and then submitted their report in first. We subsequently did issue cease and desist orders to them. I did have a meeting with the MSP post commander regarding potentially having a trooper go and visit that establishment, which they did, and they did submit a report up through the MDHHS process. It's also my understanding that MDARD will be issuing a cease and desist order to at least one of those establishments in Newaygo County that continues to operate.
Thank you. I'm clear on it now.
I don't see any other questions in the chat box. So one last call for anybody on the phone.
Okay, if there's no other questions, again, thanks guys for taking time to get on the call with us. Thanks Jordan for the data update. Dr. Morris, thank you for the immunization update and being able to field some of those questions. Obviously, there will be more information coming out regarding the COVID vaccine. As Dr. Morris said, the ACIP group is meeting today, so we expect that we'll learn a little bit more following that meeting, and then waiting for action on the emergency use authorizations for the vaccines, and then kind of starting or adding the vaccination COVID vaccine process into everything else that we're doing with case investigation, contact tracing, enforcing, and then all of our other, all the other public health duties that we are still continuing to provide. So, we'll continue to provide updates. We do have this meeting, I think, set up weekly through the end of the calendar year. And if need be, we can extend it beyond that if you guys find this beneficial. So other than that, I think we'll just plan on reconvening next week, Tuesday. If you have other questions before then, don't hesitate to reach out to us. If I can't answer it, we'll get an answer for you and then get that back to you. I think Dr. Morris had a list of things she was going to look for. We'll get those to Brett and he can send all those out to the group. So if there is nothing else from anyone, I think that's all we have for today. Again, thanks guys for getting on the call, and everybody have a good rest of the week and stay safe.